IPLs or photofacials are light sources that are used to reverse sun damage, improve the texture of your skin, in theory shrink pores a little bit, and even out your skin tone. So how does this work? It works by targeting chromophores in the skin. So chromophores are different things in the skin like pigmentation in our freckles and brown spots, blood inside of a blood vessel, and also collagen to stimulate new collagen. So this results in tightening as well as reduction in number of blemishes on our skin. So why the IPL? Because basically this device has no downtime and it also leads to perfect skin. And this is something that most people are striving for, is that beautiful skin, especially in this age of TikTok, Instagram, and also social media. I remember once I went to a conference, I teach at USC, and I saw a guy who I had known for years, and I was looking at him, and when I had originally met him 20 years ago, he didn't look that great. But his skin was radiant and he looked better than he did 20 years ago when I had met him. And I realized what he had done is he'd done the IPLs on himself over the years and he looked terrific just from doing the IPL. So with this device, we usually need 5 to 6 treatments. We do it traditionally every 4 weeks. There's no science that says we have to do it that way. And I myself will sometimes use it every week to 2 weeks. And typically the treatment is going to take about 20 to 30 minutes per area that you're going to treat. Everyone wants to know, is this going to be painful? Well, pain is relative. However, I think it is a little bit painful. So in our practice, we want to minimize your amount of pain. So what we do is we use topical anesthesia that we leave on for 10 to 20 minutes. We also recommend ibuprofen. If you take 600 milligrams of ibuprofen prior to this treatment, it really does reduce the pain. And also we use a device called a Zimmer, which is just a cold spray that really helps with the pain. So with all these things, we really try to make comfort a priority at our practice. The cost is variable, and what I've seen is it's typically cheaper if you go to a spa, and usually cheaper means either a less powerful device or less experienced providers. The risk with this is really minimal. There can be a little bit of redness. On the first session, if you have a lot of browns, you can have this coffee ground appearance after the treatment. That'll typically exfoliate after 7 days. And this is the result of the device lifting off the brown pigmentation on your skin. There are occasional superficial burns, and sometimes there's a little bit of striping if you have a tan before you do the treatment. Aftercare with this is really simple. You wear sunscreen, and I also recommend that you use bleach and Retin-A. The Obagi system is my favorite because you want to protect that investment and keep your skin looking beautiful. Because if you go back into the sun without protecting your skin, you're going to start to develop those red spots and brown spots all over again. So this is a great treatment. I actually use this one on myself all the time. It's overlooked by a lot of people because they like the sexier things like Botox and fillers. However, there was a study that showed that young people evaluate how old a person is based on the number of the brown spots that they have. So this is a great device to make you look younger based on that study. And a huge goal for me is to get it so women don't have to use makeup. They can just have beautiful, clear skin without putting on makeup. And finally, it makes you look younger and fresher. And who doesn't want to look younger and fresher?